What you're looking at is pretty shocking. A heroin addict overdosing. Her name is Liz. She's been using drugs since she was 11. Today, she's 29. Adam Wigglesworth and Louise Vincent were both with her that night in August. They both volunteer with a program in Greensboro, North Carolina that provides clean needles and other assistance to addicts.
She seemed to be pretty unresponsive, and we were noticing a bluing of the lips, lack of oxygen, so her breathing had become quite shallow.
Well, once someone's not breathing and they're not responding to any sort of stimulus, you give them breath, and at that time, I usually administer Naloxone.
Now watch what happens next.
We gave her about 60 units of Narcan.
Narcan, also known as Naloxone, can reverse an overdose from heroin and other drugs, like oxycodone. Another sternal rub, another shot of Narcan.
All right, let's go ahead and give her some more Narcan.
Giving her the rest of this full CC.
And finally, Liz begins to come to.
Liz, you okay? You went out. We're giving you mouth-to-mouth resuscitation. We've given you some Narcan. Liz, you overdosed. Can you sit up? Yeah. All right, come on. There you go. You want a glass of water?
And I can tell you, Aaron, I got a chance to meet Liz, who you're looking at there, and she's doing very well today. This drug, Naloxone, has been something that's been used for years in emergency rooms, but the push now is to get it in the hands of first-line responders, EMTs, and also potentially people who use heroin themselves. It's controversial in some areas, but as you might imagine, as you saw there, it can potentially really rescue someone from an overdose. The goal is to call 911 first and then possibly give this medication, Aaron.
So, Sanjay, when we talk about, in the case of Philip Seymour Hoffman as an example, and I know we don't have the toxicology, we don't have the full details, so you're not able to give a medical point of view for sure, but the question with this drug is, could it work on any overdose? Could it have saved a life like his?
Well, this works on specific types of drug overdoses, but heroin is one of those types of drugs. Typically, you think of narcotics, morphine, fentanyl, these things that are sort of these high-dose pain types of medications. But heroin falls in that same category as well. We don't know, Aaron, to your point, because we don't know the full toxicology report. We do know that there have been cases where heroin has been laced, if you will, with fentanyl, which is another pain medication that works very, very quickly. But there's an important point here, Aaron, and that is that someone would have needed to be there. You need to have somebody else there to actually give the medication.
Right.
This is what the kit looks like right here. It's a couple of vials, syringes, and again, it comes with instructions. But the goal is to get these in the hands of people who might potentially benefit from them.